We're coming to you live from our NTV Kisumu studios, where of course we've been following on the election season, and of course one seat that of course is poised to cause a lot of tension, and of course voters really trying to make sure that they can choose the elected leaders. That's the governor's seat, and today we're honored to have the governor aspirant for Kisumu County. That's Dr. Hezron McObewa, who's joining me this evening, and of course he mentions that his three-point agenda is on health, education and jobs. Kindly expound, sir.
Thank you very much, Laban, for having me in the studio. Thank you very much. First of all, I want to say that Kisumu is the fulcrum of Western Kenya, not just in politics, but also the economy. And it's therefore very important for Kisumu as a city and a county to actually show the way. In this town and in this county, I have traveled, I have listened to people, and I've found out that a lot of families are unable to actually afford their basic needs. Health is key. One of the things that we want to do when we take over this town is to ensure that every Kisumian who is unable to afford health insurance can have NHIF. That is our first priority. The second thing we want to do is that we want to make sure that we improve our facilities and upgrade them to ensure that we can retain healthcare staff. And thirdly, for those people living outside the city who need to access healthcare, we want to ensure that the level 1 and level 2 facilities such as dispensaries and health centers are open longer, they are manned longer, and they are equipped and resourced better.
Of course, it will make sense because you're a medical practitioner, yes, and notice perhaps that's why you have health as your #1 priority. What do you feel that the incumbent governor did not do that you want to do differently?
I think the first thing to say is that Governor Ranguma, who is also the chair of health at the COG, has presided over one of the longest industrial disputes among healthcare workers. We have got a low morale within the healthcare workers in Kisumu itself. We have got facilities which are actually under-resourced. There are no medicines, there are no doctors, there are no health personnel. And worse still, we have got poor access to these facilities because the infrastructure around Kisumu itself in terms of rural roads and access roads to these facilities, not just healthcare, but also schools, are very poor.
Mm-hmm. Let's talk about something that has been going online on social media, of course, with your opponents saying that on your comments about commercial sex workers, that you do want to kind of give them an ease or on a level playing field in their business operations. Kindly clarify on this, and did you actually say that they should offer international benchmarks to commercial sex workers in Kisumu?
I think first of all, we must all recognize that prostitution is a vice. For me, as Dr. McObewa and as a health practitioner, one of the reasons why I met commercial sex workers in this town, and they are in their thousands, is because we want to actually ensure that they're signposted to screening services such as cervical cancers, such as STIs and HIV and AIDS. But most importantly, these women have not got into prostitution because of choice. Some of them have got families, some of them are orphans, and some of them have gone into it through poverty. We want to bring them into the mainstream economy, but most importantly, we want to ensure that they are part and parcel of the growth of Kisumu.
So you're sure that your move is not going to look like it's encouraging the vice to spread in Kisumu?
I think it's the recognition that it exists, and putting your head in the sand like an ostrich is really not an option. We need to bring them onto daylight to ensure that they are also part of our health screening that we want to do within the county.
Before I let you go, of course, we're on NTV Business. We're looking at the investments that's actually going into the campaign. You mentioned that on an average, perhaps you're spending about 1 to 2 million shillings per day on your campaigns. And who's funding you?
I think first of all, we have to say is that, we've run a very efficient campaign, which is based on ideology and policy. We've gone to villages, we've talked to people, we've listened to them. To campaign, you must have resources, but most importantly, you must be able to pass the message the way that you want to actually pass it. And Dr. Hezron McObewa, I am standing for governor for Kisumu County on the basis of what we have done, what we are doing, and what we are going to do for people. That is why we've got a tagline in Luo which says Osetimo Podotimo.
Very well, let's leave it at that. Very well.
Thank you very much.
My name is, of course, it's just been like a kind of a look into the business community, just looking at what has been transpiring today on the governor post aspiration. And his three-point agenda is on health, education, and jobs. Of course, him being an entrepreneur has diversity of interest and also a philanthropist. And of course, we'd like to delve deeper. The D-Day is Monday, when we'll have the ODM nomination certificate being issued to whoever takes the day.